Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Questions on this exam are taken from random various nursing concepts. Read each question carefully and choose the best answer. You are given 1 minute per question. Spend your time wisely. We will give 30 seconds for answering. After that, we will mention the answer with explanation. Answers and rationales are given below. Be sure to read. Let us start. Question number 1. A client comes to the clinic for the treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Options: Trichomoniasis, Chlamydia, Staphylococcus, Streptococcus. Explanation: Chlamydial infections are one of the most frequent causes of salpingitis or pelvic inflammatory disease. Question number 2. A registered nurse who usually works in a spinal rehabilitation unit is floated to the emergency department. Which of these clients should the charge nurse assign to this RN? Option number 1. A middle-aged client who says, "I took too many diet pills and my heart feels like it is racing out of my chest." Option number 2. A young adult who says, "I hear songs from heaven. I need money for beer. I quit drinking 2 days ago for my family. Why are my arms and legs jerking?" Option number 3. An adolescent who has been on pain medications and a large crack hit with an initial assessment finding pupils and a relaxed respiratory rate of 10. Explanation: Nurses who are floated to the other unit should be assigned to a client who has minimal anticipated immediate complications of their problem. The client in option C exhibits opoid toxicity with the pinpoint pupils and has the least risk of complication to occur in the near future. Question number 3. When teaching a client with coronary artery disease about nutrition, the nurse should emphasize your option number 1, eating 3 balanced meals per day. Number 2, adding complex carbohydrates. Number 3, avoiding very heavy meals. And number 4, limiting sodium to 7 grams per day. Explanation: Eating large, heavy meals can pull blood away from the heart for digestion and is dangerous for the client with coronary artery disease. Question number 4. Which of these findings indicate that a pump to deliver a basal rate of 10 ml per hour plus PRN for pain break through for morphine drip is not working? Option number 1. The client complains of discomfort at the IV insertion site. Option number 2. The client states, "I just can't relieve from my pain." Option number 3. The level of drug is 100 ml at 8 am and 80 ml at noon. Option number 4. The level of the drug is 100 ml at 8 am and is 50 ml at noon. Explanation: The minimal dose of 10 ml per hour, which would be 40 ml given in a 4-hour period. Only 60 ml should be left at the noon. The pump is not functioning when more than expected medicine is left in the container. Question number 5. The nurse is speaking at a community meeting about personal responsibility for health promotion. A participant asks about chiropractic treatment for the illnesses. What should be the focus of nurse's response? Option A. Electrical energy field. Option B. Spinal column manipulation. Option C. mind-body balance, and option D, exercise of joints. Explanation. The theory underlying chiropractic is that interference with transmission of mental impulses between the brain and the body organs produces diseases. Such interference is caused by misalignment of the vertebrae. Manipulation reduces the subluxation. Question number 6. The nurse is performing a neurological assessment on a client post-right CVA. Which finding, if observed by the nurse, would warrant immediate attention? Option A, decrease in level of consciousness. Option B, loss of bladder control. Option C, altered sensation to the stimuli. Option D, emotional ability. Explanation. A further decrease in the level of consciousness would be indicative of a further progression of the CVA. Question number 7. A child who has recently been diagnosed with cystic fibrosis is in a pediatric clinic where a nurse is performing an assessment. Which later finding of this disease would the nurse not expect to see at this time? Options A, positive sweat test. Option B, bulky greasy stools. Option C, moist productive cough. And option D, meconium ileus. Explanation. Noisy respirations and a dry non-productive cough are commonly the first of respiratory signs to be appear in a newly diagnosed client with cystic fibrosis. The other options are the earliest findings. Cystic fibrosis is an inherited condition affecting the cells that produce mucus, sweat, saliva, and digestive juices. Normally, these secretions are thin and slippery. But in case of cystic fibrosis, a defective gene causes the secretions to become thick and sticky. Instead of acting as a lubricant, the secretions plug up tubes, ducts, and the passageways, especially in the pancreas and lungs. Respiratory failure is the most dangerous consequence of cystic fibrosis. Question number 8. The home health nurse visits a male client to provide wound care and find the client lethargic and confused. His wife states he fell down the stairs 2 hours ago. The nurse should: Option A, place a call to the client's healthcare provider for instructions. Option B, send him to the emergency room for evaluation. Option C, reassure the client's wife that the symptoms are transient. Option D, instruct the client's wife to call the doctor if the symptoms become worse. Explanation. The client requires immediate evaluation. A delay in the treatment could result in further deterioration and harm. Home care nurses must prioritize interventions based on assessment findings that are in the client's best interest. Question number 9. Which of the following should the nurse implement to prepare a client for KUB radiograph test? Option A. Client must be NPO before the examination. Option B. Enema to be administered prior to the examination. Option C. Medicate client with Lasix 20 mg IV 30 minutes prior to the examination. Option D. No special orders are necessary for this examination. Explanation. No special preparation is necessary for this examination. Question number 10. The nurse is giving discharge teaching to a client 7 days post myocardial infarction. He asked the nurse why he must wait 6 weeks before having sexual intercourse. What is the best response by the nurse to this question? Option A. You need to regain your strength before attempting such exertion. Option B. When you can climb 2 flights of stairs without problems, it is generally safe. Option C. Have a glass of wine to relax you, then you can try to have a sex. Option D. If you can maintain an active walking program, you will have less risk. Explanation: there is a risk of cardiac rupture at the point of myocardial infarction for about 6 weeks. Scar tissue should form about that time. Waiting until the client can tolerate climbing stairs is the usual advice given by the healthcare providers. Thank you. Have a nice day.